Hello. Happy Wednesday. Hi, guys. Come on in, you guys. Tap the screen as y'all come in. Hello. Happy afternoon to you. How are y'all? Come on and get this midday goodness. Come on and get this midday goodness. Get on in here. Hi, you guys. Tap the screen as y'all come in. Hey, Tiff. Hey, Andrew. Oh my God. I didn't even text my team. Hold on, y'all. Gotta let them know that I'm live. I forgot. I just hopped on because I'm feeling good. Hi, you guys. Tap the screen as y'all come in. Share the live as y'all come in. Hello. Hey, Miss B. How are you? How are you doing today? That's Miss B from YouTube, you guys. We are live on YouTube, Facebook, and TikTok. Hey, Vivi. Vivi, I'm not going to hold y'all too long. I'm not going to hold y'all too long. How are you, Vivi? Hey, Miss B. She says, I've been sending messages. Let me catch you live because I have a question. Wise Coaching says, hi, glad to catch you live today. Hi, friend. How are you? It's mid-afternoon. If you are watching live from YouTube and Facebook, go ahead and drop a little comment in the chat so I can give you a shout out. Wise Coaching says, you cute, all made up. Thank you, friend. Listen, no glasses because I got new contacts. Hey, Candy Cole. Hi, everyone. Winter Haven, Florida is where they are tuning in from. TikTok, how are you guys? You guys are quick on the draw. Y'all already got me up to 600 likes. There's already 94 people in the chat. Hold on, y'all. Let me make sure my people are okay. Okay, Andrew, if you're on here, we're gonna talk about your merch. We're gonna talk about your merch as soon as I get out of live. I'm just seeing the text, baby doll, because I want to get your stuff ordered. Okay, so for the 103 people who are in the chat on TikTok, and for all the people who are in the chat on YouTube and Facebook, hey AC, I see you. Thank you, friend. I'm down an extra 9 pounds. You guys, my name is KEASHA Dixon. I am a registered nurse that comes on every single day to do GLP-1 education. You guys, I come on and share my 90-pound weight loss journey with you guys, y'all. I am 74 pounds down on GLP-1 medications. Y'all, I'm so excited. Listen, I'm so in my, they call it a villain era. I'm in my villain era, and I'm going to explain that to y'all. It doesn't mean anything negative. Miss B says, glad I caught you. I paused my Amble information. I wanted to ask you what dose to start on with Amble. I think you said 7.5 definitely work. I'm in maintenance, Miss B, and I am on 7.5, but I'm in maintenance. So 7.5 works for me. For the 144 people that are in the chat, my name is KEASHA Dixon. You guys, I'm a registered nurse that comes on every single day to do GLP-1 education and to share my 90-pound weight loss journey with you guys. Y'all, I was just saying, first of all, if you are here because you're looking for the link for Amble, the link is in my bio. It's in my website. Hold on, you guys. Let me just show them really quickly for the people who are just here for the link, because I know some of y'all just come for the link. Okay, Miss B. So what you're going to do, give me a little grace, Facebook and YouTube. If you are here just for the link to get your weight loss journey started, you want to start your weight loss journey and you want to start on GLP-1 medications, first and foremost, make sure you click on this picture and make sure you are following me. This is what my profile page looks like, because I am now your virtual nurse. I will be the nurse that is getting you educated on your meds, that's going to educate you about your side effects. I'm going to educate you on how to eat. I'm going to educate you on workout stuff. And listen, y'all, I'm not an avid workout person. I do resistance walking. That's my ministry, resistance walking. That's walking while wearing weights. That is my ministry, y'all. I walk and I put weights around my ankle, a weighted vest, sometimes a backpack that has weights in it, and then weights around my my wrist. That is hey Bridget, That is my activity. I don't do nothing more, nothing less. Okay. So for those of you who are just here because you need the link for Amble, you're gonna come right over to my profile, and you are gonna click on the link. You see the link, this little link chain. My website starts with HTTPS. It ends with Keisha Dixon. Once you click into that link, you're gonna know that you're in because you're gonna see a picture of me right off the bat. Okay. Now listen, this is gonna be different tomorrow. Okay. But for today's purpose, okay, you know that you're in because you're going to see a picture of me and you're going to see terzepatide, you're going to see semaglutide. I always click on the terzepatide link because that is my GLP-1 of choice, just to show you guys what your patient portal looks like. You're going to start your visit. It takes 10 minutes for you to sign up. It takes 7 to 10 business days for us to get your meds out to you. Now, you guys, listen. If you are having any problems with getting your meds, if you're having any issues with ordering, y'all please go to the patient portal and only inquire once. If you put yourself in the queue several times, you're putting yourself at the back of the line every single time. It takes 7 to 10 business days, y'all. That does not include weekends for you to get your meds. So if you order your meds, technically it takes 2 weeks for you to get your meds. Realistically, it might take like 2.5 business days. However, y'all, when I first signed up, it only took me 4. Some people, it takes less than that. Some people, it takes 5 to 6 business days, y'all. It varies, but that's why they tell us to say 7 to 10 business days, because sometimes y'all be having things going on that is above me. Okay. However, if you have an issue, it's okay. You can put it in my DM. I am going to forward your information to the owner to let them know what is going on. But your priority is getting in your patient portal and put it in the patient portal, because those are the people who are going to help you out of those situations. Okay, so for those of you who are new here, thank you. Thank you. Yes, I don't have my glasses on, y'all, because I got fitted for contact lenses. So this is where I am. I'm loving it. Finally found a doctor who knows how to treat my eyes. A lot of you guys know that I'm a cancer survivor. And when I went through chemo and radiation, it ruined my eyes. One eye, they both are bad, but one is worse than the other. And I have to wear these expensive bifocals, these expensive contact lenses, because the prescription is crazy. So I finally found a doctor who took his time and fitted me for some lenses that really work. So I'm excited about that. So you guys will still see the glasses, but I like wearing lashes. I like not having glasses on. So that's where I am on that, for those of you who are inquiring. Now, for those of you, again, who are here for the link for Amble, you just go into my patient profile. The link is always going to be there. You guys don't ever feel pressured to use the link. You know, I always tell you guys, go through your insurance companies first. If you want to start a weight loss journey and you want to incorporate GLP-1 medications into your journey, talk with your primary care physician, the physician that takes care of you day to day. Let them know what you are feeling. Let them know about your knowledge on these medications. You can go ahead and drop my name, friend. Let them know that your virtual charge nurse, Keisha, your virtual bougie nurse, has been giving you guys daily education, and just let them know that you're familiar, so that when they're talking to you, these are not things that that you're hearing for the first time. So you have to get yourself educated on the GLP-1 medications, the side effects, and all of the things, and then call your insurance company, see if these medications are on your formularies. If they are not on your formularies, you guys, I'm telling you, listen to me. If these meds are not on your formulary, you can ask your PBMs, your pharmacy benefits managers, for the prior authorization forms. Anything that you need as far as it's pharmaceutical or medical, you can do a prior authorization form. You can either fill it out yourself or you can get your clinician to fill it out. But before you do that, you need to know what the criteria is to get approval. I don't care how much information your doctor wants to forward over to your PBMs. If they don't forward the information that they are specifically asking for, you will get denied. Y'all, every insurance company is different. Every PBM requires totally different criteria. So it doesn't matter what my criteria is, because I know somebody's going to say, well, what is the criteria? Friend, I don't know. What did your PBM say? Because my PBM is saying something totally different from you all's. Okay, so call your PBMs, y'all. Preferably call them after hours. If you call them midday, you're gonna get brush off answers, because they have more. Well, I'm not gonna say more important things to do, but they're not wanting to hear from GLP-1 all day, because we are really like, we're doing the most when it comes to calling our PBM. So it's better to get them after hours, when they have time to talk to you, when you can get real answers from them. Now, outside of all of that, if you are wanting to start your GLP-1 journey and you don't have time for that, you want to get started today, you maybe don't have insurance, you getting denied with your prior authorizations, it's not on your formulary, you can go to the link in my bio. You can go, let me show y'all one more time. You can go to the link in my bio and use Amble's link. Okay, use Amble's link. Hold on, friends. So again, this is what the link looks like. You're gonna go to my website that says HTTPS, ends in KEASHA Dixon. You're gonna open that up. Once you open that up, you're gonna see the clickable links. One is gonna say tirzepatide, one is going to say semaglutide. Okay, and then you're gonna tap on one or the other. I always tap on tirzepatide just to show you guys what it looks like, your patient portals. For those of you who are here for the digital marketing course, y'all, I put it #1 in my website. Okay, y'all probably have been seeing me post more videos about digital marketing. I've been doing that because my digital marketing sales are up, and I bought a course to teach me about that stuff, and then when you buy the course, you can resell it. So y'all, my digital marketing sales have gone up, so that's something that I want to get into, because I'm actually starting to profit from that class. So I'm excited about it. So I'm gonna share it. Y'all do what y'all will with it. When I bought mine on a payment plan. So it's there. I set it up for you to get it as well on the payment plan. If that's something that your heart desires, it's in my bio, especially if you are doing TikTok shop. If you are wanting to get in drop shipping and all of the things to make you some side income. When I tell you, I didn't think that it was going to work. I honestly didn't think the class was going to work, but I used one sales pitch to pitch with Prequel. I don't know if y'all know who Prequel is, but it's the cleansing company. And I took a video from 1,300 all the way up to 70,000, and I have sold 78 units in 2 days. Just using that course. So just FYI, the course is there for those of you who are here for that. But let's get back into the GLP-1s. Let me scroll back just to see. Hold on, you guys. Let me just say my hellos. Hey Terry over there. How are you on YouTube? If there's anybody on Facebook, drop your name in the chat so that I can see you and give you a shout out. But right here on Facebook, I see Carrie Ann is here, Glegley is here, Catherine is here, Cannibal is here, Zanita is here, Christy, Kia, Queen K, Kat, Linda, Low Carb, Kimmy says hello everybody. Esqui is here. This person says thank you for the papaya enzymes. It worked overnight. Boom. Boom, friend. Okay. Did you also get you some pre and probiotic? Did you, friend? For the 160 people who are in the chat, you guys continue to tap the screen as you listen in. Do me a favor and drop some hashtag FYPs in the chat. And then if you have time, share the live with 2 people. Share the live with 2 people. And thank y'all so much. Y'all already got me up to 4.7K likes. Thank you so much. Wise Coaching is saying, any updates on the progress with Lipo B? Friend, I take Lipo C, Mick, with B, and I'm down 9 pounds. I did 11 injections. 11 injections. So that's 4 weeks, 9 pounds. You know I'm in maintenance. I'm not eating any differently. I'm not working out anymore. Just by adding the Lipo C, gave me that metabolism boost. I feel like my appetite has been the same, and I am 9 pounds down in my waistline, you guys. I should have did my inches. Tip, the lashes are in my TikTok shop. Let's see. Hey girl, sitting at my desk on lunch, waiting on you. Hey friend. Hey Lady T, girl, you knew I was coming. Hands above says hello. Boss Lady says hello. Y'all, Riri says hello. Millie from Philly says hello. Let's see. Again, Mr. Watercheck is in the building. If you guys are not following Mr. Watercheck, you know that we are starting a podcast. We got some good news coming up really soon. I know you guys are waiting for the drop date. We talked about it. It is solidified, but we want to drop the drop date together. So y'all stay tuned. The TikTok page is officially up. Go and follow us on Health and Hustle. It's Health and Hustle podcast. Hold on, let me show y'all. For the 150 people who are in the chat, click on my picture. Make sure you guys are following me. Hold on, y'all. Let me find it. Hold on one second. Y'all, we are so excited. Andrew, we got 40 followers. Okay, this is what the Health and Hustle TikTok page looks like. So please, y'all, I need everybody to click out of this live. I'm willing to lose y'all. Click out of this live and go and follow the Health and Hustle podcast and come back. If you're on YouTube and Facebook, go and follow the Health and Hustle podcast. Please do that for me. This is what the logo looks like. This is our official logo. Y'all, I'm so excited. Y'all, listen. Listen, Linda. Baby, we about to spoil all. Listen. Come on with it. If you're not following the podcast, y'all do me a favor. Go and follow the Health and Hustle podcast. I see 43 followers. I'm so excited, y'all. We cannot wait to drop our first episode because it is packed with so many different emotions. You're going to be elated. You're going to be excited. There may be some things that may be tense. There may be some things that make you think, I knew that. I was wondering that. All of the things, y'all. We're doing it all, okay? We're doing it all. I cannot wait to share that with you guys. For the 130 people who are in the chat, click on my picture. Make sure you guys are following me. Also, make sure you guys are following the Health and Hustle podcast, okay? Let's see. Tia, the eyelashes are in my TikTok shop. So y'all, Synovia Jean says that she went to the doctor yesterday. She said she's down 17 pounds in 10 weeks. Come on, Synovia. Congratulations to you, my friend. Miss Thina, thank you for the follow. Y'all, Cheryl says, who was the doctor? My sister is having the same issues with her eyes. Just had an eye replacement. Friend, are you here in Houston? Hey, Miss Wendy over there on YouTube. If you're here in Houston, friend, DM me and I'll get the doctor to you. Which one has the most side effects? It's tirzepatide. Listen, tirzepatide all day long. Tirzepatide is dual acting. It has GLP-1 and GIP. So if you have greater than 30, 40 pounds to lose and you have accompanied comorbidities, you need to definitely be on tirzepatide, okay? Y'all, Charlene says hello. Nadine says, I'm getting one of my friends that need this medicine. Very good, friend. Just let them know the link is in the bio. No pressure. Michelle says this product is very good. Queen V says, hey. Miss Reese, thank you so much for dropping the FYP for me. Hey, Miss Mary, thank you for the follow. Min Young says hello to everybody. Mama Glenda says, I'm waiting on my cup. It was out of stock, but I will send you a picture when I get it. Mama Glenda is the person who won the coldest cup giveaway. Y'all know I do a giveaway every single month. I'm either going to give away a coldest cup, a Stanley cup, or a Miyoki cup. And then whoever is subscribed to me on YouTube, you guys get a Starbucks gift card where you can get you a cup and you can get you a coffee cup. Okay, so Mama Glenda won the coldest cup gift card for the month of August. So this month we're going back to Stanley. So this month will be a Stanley cup, and then this month we're gonna be doing a giveaway where there has to be engagement. Okay. Miss Wendy says, have you noticed all the telehealth folks are coming down on prices? trying to compete with Amber. We got them running scared. Wendy! Oh, Wendy. Wendy, how you doing? Wendy, how you doing? I want to revisit this conversation at a later date. Okay, moving on. For those of you who are new in, there's 140 of you in the chat. If you are new here and you have never seen me before, click on my picture. Make sure you guys are following me. And turn on your notification bells because I come on every single day to do GLP-1 education. You guys, I share my 90-pound weight loss journey with you all. 74 pounds down on GLP-1 medications. Y'all, I'm so excited for myself. I'm so excited for you guys. So if you have any questions, I am a registered nurse. I do work under the umbrella of emergency room medicine. I've been on my journey. It'll be 2 years on the 16th of this month. So there's nothing that you can ask me that I won't have an answer for, or I do not have a referral for you. One of two things is going to happen, but you're going to find out, you're going to get the answers to the questions that you're asking me, okay? I'm either going to know or I'm going to refer you, okay, to where you can get the answers, okay? Thank you so much, you guys, for all of the follows. If you are new in, you guys go to Health and Hustle. Y'all, this is the me and two of my really good friends started a podcast. It's called Health and Hustle. Please go on over to TikTok right now and hit the follow button, you guys. Hit the follow button, y'all. The YouTube channel will be up by 10 p.m. tonight. So if you want to go over and follow us on YouTube, because you will be able to listen into the podcast on Spotify, on Apple Podcasts, and you will be able to watch it on YouTube. So the YouTube channel will be up, you guys. This is our official logo. We also have merch that is coming out as well. For the 180 people who are in the chat, please take one moment to first click on my picture. Make sure you guys are following me, and I welcome you to click out of the live and go over to Health and Hustle and hit follow, okay? You guys are doing such an amazing job. When I started my live, we had 59 followers. Now we're up to 60. Do me that favor. You don't want to miss this. I promise you. This podcast is going to shake up the GLP-1 community in the best way. You know, it's all positivity over here, honey. We getting into mental health. We're getting into medication. We're getting into physical. We got comedy. Friends, we have intimate conversations between three friends that talk real talk. So nothing is going to be censored. You understand what I'm saying? If you are new here and you are new to my platform, I am a registered nurse, you guys. I work under the umbrella of emergency room medicine. I come on every single day to do GLP-1 medication education, and I also share my weight loss journey. Hey, Liz. Hey, Elizabeth. How are you? Hi. Hey, Nurse Kima. You guys, Nurse Kima is not feeling well today. So if you guys can all send positive vibes her way, healing hands her way, I would greatly appreciate it, y'all. I haven't seen my friend sick. I don't think I've ever seen her under the weather, but she's really not feeling good. So if you guys can please send a lot of love Kima's way, I would greatly appreciate it, you guys. Thank you guys so much. As a matter of fact, let me go ahead and pin her so you guys know who I'm talking about. Give me 1 second. 1 second, guys. Oh shit! Did I mute her? Oh, I'm sorry, y'all. Hold on. No. Okay, there we go. I'm so sorry. Oh, Kima. Oh, Lord, you know I would have hopped out of this live if that would have happened. You guys, please send positive vibe Nurse Kima's way. Please send all the love, all the healing hands her way, because she's really, really, really under the weather, okay? For the 165 people who are in the chat, if you are not following me, please click on my picture. Make sure you guys are following me, y'all. Before y'all end the day, please go over to the TikTok Health and Hustle page and hit follow, you guys. Kima and Andrew have started a podcast that is going to shake up the GLP-1 community in the listen, y'all, in the most positive way. Okay? You know, we bring positive vibes. We bring positive vibes. Okay, we're already up to 66 followers. Thank you guys so much. I appreciate you guys. We started the live at 40 followers. And then you guys, the YouTube channel will be up by 10 p.m. tonight, my time. I live in Texas. What am I, Central Standard Time? Okay, so for the 174 people who are in the chat, click on my picture. Make sure you guys are following me. If you guys are wanting to start your weight loss journey and you want to incorporate GLP-1 meds, I always tell you guys, call your insurance company, see if it's on your formularies. If not, request a prior authorization. Meantime, in between time, use the link in my bio. Get your semaglutide and tirzepatide sent to your doorstep. No physician fee, no subscriptions, no application fee. There's no labs that are needed. And there's no shipping, y'all. This is meant to be a quick service, okay? You don't need labs. Go to your primary care for that. You're already paying for it through your insurance. You don't need for us to charge y'all on top of that, okay? Go on to your primary and get them to do them labs. You should have had them done already. You don't need labs over here. This is a quick service. You in and out, and your medicine is on your doorstep, okay? All right. So let me see. Let me make sure I don't have any questions in the chat. Kima, everybody is saying they hope you feel better soon, my love. It's so good to see you in, Elizabeth, as well. Miss Lingo says, new hello, I just followed. Thank you, love. Welcome to the family. I am your new bougie GLP-1 nurse. Okay, you cannot take it back. You done stepped into the office. So friend, it don't matter where you go, you're gonna see me somewhere, and I'm gonna be holding you accountable for if you have met your protein goals. As a matter of fact, let's talk about it. Did everybody do their KEASHA today? Did y'all do y'all KEASHA? Did y'all fix y'all's 40-ounce Stanleys? Okay, I'm on my second one. This is my second one. Okay, and as a matter of fact, Mr. Water Check, everybody pick up their Stanley and let's get some drinking in. I'm going hard today. Hold on. Oh, God. Oh, Lord. I don't care what nobody say. It's nothing like ice cold water. And nothing gonna quench my thirst like some ice cold water. So y'all get y'all water in, okay? You got your water wise coach and Miss B, VV. Y'all got y'all water over there? So somebody was saying something about their insurance. Hold on. Let me scale back for a second, guys. For the 160 people who are in the room, if you are wanting to start your GLP-1 journey, the very first thing you need to do is keep yourself connected to your GLP-1 community, because nobody is going to understand your journey like we are. And nobody is going to give you the education with love like we're going to do it. Click on my picture. Make sure you guys are following me. Do not leave out of this live without your resource. Okay, I am your resource. I'm a registered nurse, y'all. I've been a nurse. It'll be 23 years come December. I'm a cardiac nurse, cardiology. Hold on, y'all. Let me turn my camera a little bit. Sorry, guys. Cause that sorry, you guys. Let me turn because my lighting was a little bit off. Cardiology was my first love, you guys. Hold on one second. Yes, I started my career off in cardiology. I used to work at a heart hospital, and I absolutely loved it. When I got cancer, I moved to Houston and started a new journey. So I work under the umbrella of emergency room medicine. I absolutely love it. I work in trauma. Well, trauma medicine, medical, it just depends, y'all. Oh my God. And I'm also the charge nurse of a 20-bed outpatient unit that I absolutely love as well. I started my journey, my weight loss journey 2 years ago, come the 16th. Y'all, I'm 90 pounds down. I started my journey doing keto, and I just couldn't keep up with it, you know. And like many of you guys, I have started a journey on several different programs, and I was successful, but my weight always came back. But now you guys know that we have a tool, we have medication that we can use, and it's okay if you need medication, because for some of us, the problem isn't that we want to eat a lot. It's not that. The problem is not that we're not all not healthy. That's not the problem. For a lot of us, the problem sits on the endocrine level, and we need medication to help us with that. So what if we have to take an injection once a week for the rest of our lives? I know I'll be taking it for the rest of my life because I'm not gaining no weight back, and I'm not finna deal with food noise and the anxiety that comes along with it. I want to love on my family. I want to increase my longevity. I want to have the best quality of life that I can possibly have. And I couldn't do that on my own. And I'm not ashamed to say it. I don't give a damn about nobody who think that I'm taking the easy way, because I've always been taught to work smart, not hard. I'm not going to put my body through crazy foolishness when I know it's an endocrine issue. I don't care who don't like it. This is what I'm doing. This is what I'm teaching. This is what I'm educating, because we know from clinical studies and evidence-based practice that these medications help you on the endocrine level. It helps you to become more insulin sensitive. It helps you to be less insulin resistant. It prevents you from overeating and all of the things. And for those of you who are sitting in all of your ignorance, talking about or thinking, oh, well, the side effects is what's going to get them. Oh, who wants to have an upset stomach? Friend, I can promise you, if you read the side effects of diabetic medication that diabetics have to take, if you read the side effects of insulin, if you read the side effects of cardiovascular medicine, it will scare you to death. Okay? It would scare you. It would scare you. So if I have to deal with treating some nausea, nausea, honey, I'm gonna just take my nausea medicine. Heartburn, Zantac, sulfur burps, Tums. Dehydration, I'm gonna drink water. I'm gonna get me some Pedialyte. I'm gonna get me some Gatorade. What y'all talking about? People be off. We just talking about some belly discomfort that you can treat over the counter. You're not gonna scare me into not taking care of myself and making sure I'm here to see my daughter graduate from college, or my grandkids graduate from college. Do y'all know how much of a grandma I want to be? Do y'all know how I want to be the grandmother in the stands with the signs yelling my ass off and just showing out in the stands, dancing and keeping up with all the trends that them young people be doing? With my cute little eyelashes on, my cute little extensions, honey, my eyebrows done, my lip gloss is popping. I cannot wait. They gonna say, that's your grandmother? Yes. Hello? Yes, that's my grandma. And don't call her grandmother. Please, don't do it. Y'all better call me Cookie. Don't call me grandmother. Okay? That's what I want to be. And I'm just so thankful that I have GLP-1s to help me get there. Okay? Joni is saying, I'm waiting on my Kiala. I can't wait to start. I bought 2. You're going to love it. The coupon does not help. My prescription is still $1,000, and I'm not a pre-diabetic. So, friend, you need to use the link in the bio and get your semaglutide and your tirzepatide sent to you to your doorstep. Stop playing with those insurance companies, because they are, listen, they doing too much. The insurance companies are doing too much. Now, listen, I'm not being literal. Stop playing with the insurance companies. I'm just saying, while you fight with them, come over here and get your compound so that you are actively on your journey and you're not stalling because of their problem. You're still going to fill out your prior authorizations. You're still going to get your criterias. You're still going to go to your doctors or whoever is doing your PAs to make sure that your PAs get sent in. I don't care how many denials you get. We still going to keep sending them until we get an approval. But meantime, in between time, we're going to use telehealth. Okay? Amble is a highly reputable telehealth company that doesn't charge any overages. And we have competitive pricing. Y'all hear me saying we have competitive pricing. If you're an Amble patient, you have competitive pricing. There's no gimmicks. You're not getting a price point for a certain amount of time. Whatever it is whatever price we tell y'all, that's the price that you guys are paying. We ain't switching up. Okay, what's y'all's go-to protein shakes besides Premier? Friend, I like Fairlife and I like Seek. Let me see if I can show you. Do you see? Hold on, baby. Hold on, friend. Do you see that yellow container right there? That's Seek. That's y'all. Who is asking that question? Let me see. The treat maker is asking y'all what protein supplement are y'all using? I use Seek. For the 177 people that are in the chat, if you are new here, click on my picture. Make sure you guys are following me. You guys, my name is KEASHA Dixon. I'm a registered nurse who works under the umbrella of emergency room medicine. I'm also on my weight loss journey, you guys. I come on every single day to do GLP-1 education. Y'all, I am officially y'all's bougie virtual nurse in GLP-1 space. Okay, my go-to nurse is Ask Nurse Kima. Y'all's go-to nurse is Bougie Nurse Keisha. Let's be clear, because I have a nurse as well. Her name is Ask Nurse Kima. Let me pin her. Hold on. Hold on. This is my nurse. She mine, not y'all. She's mine. That's my nurse. I'm y'all's nurse. Let's be clear. For the 200 people that is in the chat, my name is KEASHA Dixon. I work under the umbrella of emergency room medicine. Okay, I'm on my weight loss journey, just like you guys are. I am y'all's bougie nurse educator for GLP-1 medicine. Make sure you click on this picture. Make sure you guys are following me, because I come on every single day to gather y'all. Okay, in the most loving way. In the most loving way. What is your protein goal for the day? What is your water goal for the day? Did you work out today? Hello, for the 200 people that is in the chat. Click on my picture. Make sure you guys are following me, because I am your accountability partner. Okay? Did y'all get y'all water? Are y'all starting y'all's water? Did y'all get it started for the day? This is my second Stanley, y'all. My second Stanley of the day. Okay? All right. For the 200 people that are in the chat, y'all, I'm down a couple of messages. Let me make sure I got everybody's question. Chicken Licking is asking, are the lives recorded I missed last night? There's always new information. Yes, baby doll, but I didn't upload the last 3. Chicken Licking, please give me a little bit of grace. I promise you I'm gonna upload them by morning. Okay, hold on, because I gotta hold myself accountable. Hold on, baby doll. Hold on, sweetheart. Upload vids. Something else. Oh, and y'all, the Health and Hustle podcast will be up. The Health and Hustle YouTube will be up, not the podcast, not the first drop, but the YouTube will be up. So please go over and follow Health and Hustle. For the 210 people who are in the chat, click on my picture. Make sure you guys are following me. Make sure you guys stay connected to me. And please do me a favor and go over to the Health and Hustle TikTok page and make sure you guys are following. Y'all, we got some exciting news coming up, especially the drop of the very first video. That very first video, you can listen to it through Spotify, Apple Podcasts, and you can watch it on YouTube. We are already up to 73 follows. Thank you, guys. I promise y'all don't want to miss this. Y'all don't want to hear about it. Y'all want to be about it, okay? Y'all do not want to miss it. Okay. So let me see. Hold on, you guys. Someone has a question. A few of y'all have a question. Hold on one second. I'm so sorry. Zanita says she's drinking her Kiala greens right now. Damn Pam says, hold on, boo. She says, I tell people stay fat, then stay borderline diabetic, then I'm going to jab myself and be healthy. Okay, friend. I know that's right. Can you please elaborate on tirzepatide causing thyroid cell in rats, friend? So the cancer that was found in the male rats was thyroid medullary cancer, only that cancer. So it's not been found in humans. There's no cancer that has been found in humans. So that's the only thyroid cancer that is contraindicated in taking those medications. That one specifically, okay? 123 4 5 6 says, I've been on it for 2 months. It hasn't done anything for me. Am I doing something wrong? So friend, it's possible that you could be doing something wrong. It's possible that you aren't. You have to remember that these are endocrine medications. These endocrine medications are going to help you on the endocrine level first. So if you are storing fat differently, if you're metabolizing fat differently, then these meds are going to speak to that first. It may be that you are insulin resistant. You might not be insulin sensitive, so it's going to work on that first. If you are a diabetic and your blood sugars are not controlled, it's going to work on that first. Then you'll start to see weight loss when you have incorporated a healthy diet, when you have incorporated a healthy workout regimen. And I'm talking about something that speaks to you. You know what you can do at over 200 pounds. You won't, what you can do at 150 pounds, you won't be able to do it at 200 plus pounds. You have to do what your body allows you to do. But the most important thing is just to be active. So once you have incorporated those things, in addition to your GLP-1 meds, friend, you'll start to see weight down, okay? And it's supposed to be slow. It's going to be slow. You guys, these meds are meant to treat you chronically. That means long term. So the expectation to have weight loss, significant weight loss in your first 1 month to 4 months is unrealistic. It happens for some people. For a lot of us, it doesn't. My weight loss was extremely slow. Okay? All right. So somebody is asking what is the best. Tirzepatide is the best because it yields two hormone components, GLP-1 and GIP, okay? That's why you tend to see more patients have better results on Mounjaro, Zepbound, and on compounded tirzepatide. If you are here for the very first time and you are wanting to start your weight loss journey using GLP-1 medications, we can get your meds out to you through Amble. You guys, the link is in my bio. All you have to do is come on over to TikTok. This is what my bio looks like, and my website is right underneath my email address. You just click into my website and you're going to be looking for the clickable links that says tirzepatide and semaglutide. They're there. Hold on, friends. They're there. I'm going to click into tirzepatide because that's my GLP-1 of choice. Once you open up that link, you will then see your patient portal. This is what the patient portal looks like for Amble. It takes you 10 minutes to sign up. It takes us 7 to 10 business days for us to get your meds out to you. You guys, listen, the meds come to your doorstep. There's no physician fee. There's no shipping. There's no application fee. There's nothing that you have to subscribe to, and you do not even need labs. And I know some people try to hate on that because they think they're being slick. But truth be told, you get your labs annually through your primary care, okay? If you are a diabetic, you should be getting labs every quarter. I know my husband gets his every quarter. There's no need for Amble to do labs on my husband. He already have them done. So why would Amble offer that? Me and my daughter, we get labs done annually because we don't have comorbidities. We just do regular checkups and we get our labs done at that time. You do not need extra labs unless you are having issues with your kidneys or you're having issues with your heart. They can trend, or you're diabetic. Outside of that, if you're just an obese patient, you don't need but just annual labs, y'all. Stop letting these people tell y'all that. I'm a nurse. I've been a nurse almost 23 years. Your doctors are not going to just order labs for you just because you want them done. There has to be an indication. They have to be able to tell the insurance companies why they're doing it. They can't just do it because we want it done. Okay, GLP-1 medications delay your gastric emptying. It helps you to feel full fast, makes you feel full for a long period of time. So if you are a cardiac patient, you might have like high cholesterol, hyperlipids, high triglycerides, things like that. Now, if you want it done because you want to see the result in that, then yes, they will do it. But if you are a healthy person and you don't have issues with your labs, why are you getting labs done again? Because people telling you to that don't know what's up. Kimberly P says, my first week on Amble tirzepatide 7.5, no side effects. She says, yay, but my appetite has returned. Should I give it more time or should I tell my doctor to increase the dose? Any suggestions for food noise? So yes, my love, you listen. When you get on the higher doses, that 10, that 12.5, and that 15, I think you're going to have less food noise. However, if you, so yes, that's my answer, Kim. Ask your doctor to increase your dose. Try 10 first. Now, if you get on 10 and you continue to have food noise, then I would ask my clinician about the Contrave, the Topamaxes, the metformin, the Casimia, and the phentermine. I've been doing a education series on those meds over here on TikTok, so make sure you come over to TikTok and look at my GLP-1 education. I've already done how metformin improves your GLP-1 experience, how Contrave improves your GLP-1 experience, how Topamax, and how Casimia. Now, that's if you're having issues. If you are responding to these meds, you're having 0.5 to 2.2 pounds down a week. You do not need no extra medicine. Y'all do not, listen, I know y'all want to lose weight. I know y'all want the weight to come down fast, but don't do too much. Don't do too much. Y'all do not take my videos out of context and think that I'm telling y'all that y'all need something in addition to y'all GLP-1s. No, that may not be you. I'm talking about for the people who are on high doses of GLP-1 medications and you're still continuing to have food noise and you're not seeing pounds down and it's been over 4 months. Technically, you have to give your GLP-1 medication the opportunity to do what it's going to do in your system. You got to give it at least 4 to 6 months. Because remember, these meds are used to treat you chronically long term. These are not quick fixes, y'all. Okay, our mindset, we got to come together with that. Your mindset you have to get educated. That's why I come on every single day. These meds are intended to treat you chronically. That means long term. Long term. Acute means quick. Chronic means long term. Okay? So these are not weight loss medications. They're endocrine medications that's going to take care of the root cause. The root cause why you are obese and staying obese and overeating and having all that food noise, the root cause is on the endocrine level. You're not greedy. You don't like to just be eating for no reason. It's an endocrine offset. You know, it's an endocrine issue, okay? Obesity is a chronic disease that happens on the endocrine level. It's not you, friend. I promise you it's not you. Okay. For the 211 people who are in the chat, thank you so much for being here and spending this afternoon with me. Y'all click on my picture. Make sure you guys are following me. Again, my name is KEASHA Dixon. I'm a registered nurse. I am your bougie nurse. I'm your bougie virtual nurse. If you are in the GLP-1 space, if you are doing GLP-1s, accompanying that with your weight loss journeys, I am your virtual educator. Okay? Y'all got that? All right. Ask Nurse Kima is my educator. I am y'all's. Okay, y'all got it? All right. Don't be trying to steal Nurse Kima from me, okay? I'm very territorial. Okay, so let me go back in the chat and make sure I'm gonna rapid fire answer the questions that are in the chat because I see you guys. Y'all know I like to run my mouth. Hold on one second. Thank you guys so much for being here with me. Thank you guys so much for getting me up to 16.7K already in the chat. If you are listening in from YouTube and Facebook, thank you so much for spending this time with me. You remember, if you have any questions or comment, drop it in the chat. I can see it. I will read it. I promise you that, okay? Look, Sunshine said, let's go Cookie. That's right. They're going to call me Cookie. Lady T says, yes, that's me. My 7 grandchildren, me, my 16-year-old granddaughter on TikTok. Yes. What is a good over-the-counter medication for nausea? Nausine, Upspring Settle Drops, and Ginger Chews. How much is this? Friend, if you go over to the link that is in the bio, first and foremost, short answer. If you do semaglutide, it's gonna be $199 to $219 a month. If you do tirzepatide, it's gonna cost you $299 to $379 a month. But friend, when I'm not on live and you are wanting to share that information with your family or someone that you love, come on over to my profile page and just click into my website. It starts with HTTPS, ends with Keisha Dixon. Once you open it up, you'll be at my official website, like my personal website. And if you scroll down, the links are there. It'll say tirzepatide or semaglutide. So I always click into tirzepatide just to show you what it looks like. This is what your patient portal will look like. And then it says start my visit. It takes 10 minutes for you to sign up, okay? All right. Hold on. I'm going to rapid answer these questions, you guys. Give me a little bit of grace, you guys. And if y'all don't mind, continue to tap the screen as y'all listen in. If y'all see any questions in the chat that y'all can help me answer, please help me out, you guys. Y'all know I have. It's one of me and 179 plus of y'all, okay? Let's see. Someone is asking, Miss Sunshine, can you show your products again or go over it one by one? Sunshine, I promise you I'll do that. Give me 1 second. Let me just get caught up. I like Premier, Fairlife. Okay, we're talking about the protein. Very good. As you increase dose, will it help you curb your appetite on tirzepatide? Because I'm hungry. So here again, Amanda, it just depends on what dose you're on, sweetheart. If you're on the beginning doses, and the beginning doses for me, it just that's just me saying this, is 2.5, 5 milligrams, and 7.5. If you're on those doses, I would just say give yourself a little bit more time. If you are having appetite and hunger issues, increase your protein, because protein is your powerhouse for your metabolism, and it will hold you. So increase your protein, friend. Do protein snacks and stuff like that. That will help you until you get to the higher doses. But you do have to give it some time. Tanisha says, my doctor upped my dosage. I have some left over. Should I take what's left and start the new dosage? It depends on what you have left over, friend. And you know, anything that you take, that's a clinician question. You have to ask your doctor what's best. I can only educate you on what you're doing, but I can't tell you what to do because I'm not licensed to do that. Okay. Where are you getting your Lipo B, Lipo C from, friend? I get it from Amble. Hold on. Let me get my little package so I can show y'all. Hold on, baby doll. Because I knew somebody was going to ask me about the Lipo C. Somebody always asks me. Okay, so I will get into that. Okay, so we'll get into the pregame cart and we will get into the Lipo C. I got you, friend. Let me just get caught up. Let me just take it out so I don't forget. The pregame cart and the Lipo C. I got you, baby doll. No worries. So Stacy, and I love this. Stacy says, but there are tons of cancers that you're at risk at just being obese. Stacy, hold on. Let me pin that. Because somebody in the chat was asking about medullary thyroid cancer. The cancer that they found in the lab rat when they were doing studies on this medicine. And Stacy said, but there are tons of cancers that you're at risk of getting when you are obese. Listen, there's a message in that. There's a point in that. She's not saying that for no reason, because I've not once heard anybody ask me what cancers are related to being to a person being obese. But they gonna ask about that MTC. Okay. MTC that you're not gonna get because it's not found in human. It wasn't found in humans. It was found in a lab rat. Okay, moving on. Candy Cole says, I'm getting my semaglutide from my doctor, but I want to know if I can get that back burner. Oh, you mean the Lipo C from Amble? You have to be a patient of Amble's. Jen F says, what does your appetite... okay, I'm sorry. She was talking to Kim in the chat. I'm so sorry, you guys. Sorry, you guys. That's my followers from YouTube are chatting. Do you inject glutathione? No, friend, but I want to get me some glutathione. Hold on, let me make myself a note of that. I want to get me some glutathione because I heard that it helps tremendously with the skin. I heard that people's skin is thriving on glutathione. Is that something that you heard as well? And I think we offer that through Amble. Miss Darling Daisy hello says, age 54, I'm on tirzepatide 12.5, hypothyroidism, menopausal. She says she's down 32 pounds in 14 months. She says she needs 50 more, but it is slow. So I think she's just reconfirming that these meds are used to treat you chronically, that it's going to take some time. And it is, y'all. It is going to take some time. Thank you for confirming that for me. Joy said, well, that's not exactly true. I've asked my doctor to run a cholesterol and a hormone test before. Yeah, but Joy. Okay, Joy. I'm going to just move around. I think she's speaking to when I said that your doctor is not going to just order labs for you out the blue. If your doctor ordered labs for you, there was an indication for it, friend. I thought I said that, but okay. Moving on. I've only been a nurse for 22 years, but it's okay. Let's see. Amble has charged me and my husband. Amble has changed me and my husband's life. 85 pounds in 8 months for me and my hubby. 104, all on 2.5 tirzepatide. What? JJ. Wow. That is amazing. There's someone in the chat. There's a lot of letters. I don't know how to pronounce it because there's so many different there's so many different letters. I don't know. I think it's just an abbreviation of something. But they're saying Anthem just denied me because of my BMI. My BMI is 38.8 instead of 40. What? Wow. Didn't take for 4 weeks and then I took 12.5. Got you, friend. Thank you, Tiff. She says, follow your girl. Straight facts. I appreciate that, my love. What's the best provider for a name brand? What's the best provider for name brand? You have to go through your primary care. Anybody using glutathione? Who's asking that question? Y'all, that's Claudia wants to know. Let's see. So Armor says, I'm on semaglutide 3 months with only 10 pounds down, hoping by December to show clothes size changing. I think you will, friend. I think that you will. And listen, for those of you who are on semaglutide and you feel like your weight loss is slow, it is a little bit slower on semaglutide. If you have greater than 30-40 pounds to lose and you want to meet your goals faster, just switch over to tirzepatide if you can afford to, especially through the compound. Miss Patricia says, no, ma'am, you have to share Nurse Kima and Mr. Watercheck. I'm going to think about it, honey. I'll think about it. How much of a calorie deficit should we be in? But my TDEE inputs says 1738 and I'm sedentary. So friend, I am Pumpkin. I was sedentary also. I always put in my links that I am sedentary, friend. And mine was 1800 and it took me 11 months to lose 90 pounds. Hold on, y'all. I don't know why I got a wave of heat. Ooh. I got a wave of heat. Hold on, y'all. This heat is trying to take me out along with my heating pad. I'm tripping all over the damn cord, but I ain't gonna move it. I'll fall down before I move that heating pad off this chair. Hello. Okay. What is the difference between semaglutide and tirzepatide? That is a great question, baby doll. So semaglutide it has one hormone component, which is GLP-1. Tirzepatide has two, GLP-1 and GIP. So where you are only getting one with semaglutide, you get two with tirzepatide. That's why tirzepatide will cost you a little bit more. And patients report less side effects on tirzepatide, and they also report meeting their weight loss goals sooner. Okay, I lose weight, but not in my stomach. Why? What can I use? So Abigail, you are just like me, friend. I'm the same. I still feel bulky around my belly. Well, it's getting a lot better. So let's talk about the Lipo-C. That's a good segue. That is a good segue. So for the 142 people who are in the chat, click on my picture. Make sure you guys are following me. And if y'all have not yet, hold on. Hold on, you guys. Give me a little bit of grace. Hold on one second. If you guys have not gone over to the Health and Hustle TikTok page, please go over and follow Health and Hustle, you guys. We are coming out. This is our new podcast that we are soon to let you guys know when the first drop is going to be. This is the official logo. This is the official logo, Health and Hustle. Okay, so make sure you go over to TikTok and hit follow. The YouTube channel will be up by the end of the night. Just the channel, you guys. And we're going to talk to you guys about when the first episode is going to drop. We had a meeting. We have finalized when the first episode is going to drop. So make sure you are following us on Health and Hustle, because that's where you're going to find out when the first video is going to drop. You'll be able to listen to it through Apple Podcasts. You'll be able to listen to it through Spotify. And you'll be able to watch it through YouTube. Y'all, I'm so excited. I am so excited. Okay, so Lipo C. I do get my Lipo C through Abigail. And for those of you who are interested in Lipo C is a combination of supplements that when you compound them together, they become fat burners. Okay, so this is what it looks like through Amble. Hold on. Give me a little grace, YouTube. Give me a little grace. This is what it looks like, you guys, from Amble. It says Lipomic B, and it says Lipomic plus B because it has B12 in it. For those of you who are on YouTube, this is what it looks like. Facebook, this is what it looks like. Okay, and I am 9 pounds down since I started my Lipo Mick, and I'm so excited. So for those of you who are interested in losing inches around your waistline, Lipo C again is a combination of supplements that when they are compounded together, they become fat burners. Those fat burners work on visceral fat. Visceral fat is fat that is around the waistline. So it helps to slim you out. It helps to slim out your waistline. Okay, let me just stand up and show y'all what my waistline look like. This is what my waistline look like. Now y'all know listen, I'm 90 pounds down. I'm 90 pounds down, but I am very bulky in my waist, y'all. I still feel like I got a long way to go. My back, my waist is not touching my back. You see this? This gotta go. This have to go. So that's why I'm taking the Lipo C, because I'm trying to work on that part of my belly. I want my stomach to look like Andrew's stomach. Y'all seen Andrew's stomach? Andrew takes Lipo C. And so now I'm taking Lipo C. Andrew and Nurse Kima are coaching me, and I'm already 9 pounds down and taking my Lipo C. Thank you, friend. Thank you so much. So Abigail, I don't know. I think the reason why I wanted to answer her question. She says, why do we lose weight all over, but we don't lose weight in our stomachs? Hold on, let me ask Google. Oh, I was gonna say, let me ask Siri, but I'm on Siri. Hold on, you guys. And I don't have my so that's a good question. I think it has to do with cortisol that plays a role in belly fat. Why do we lose weight all over our bodies but tend to lose weight slower in our bellies? One reason belly fat is so hard to lose is that it's considered an active fat. Unlike some fatty tissue that simply sits dormant, belly fat releases hormones that can have an impact on your health and your ability to lose weight, especially in the waist and abdomen areas. So things that burns belly fat is walking, running, biking, rowing, swimming, and cycling, and group fitness classes. Y'all got it? How much is the Lipo C? 149 through Amble. Thank you so much. Abigail is saying maybe because of childbirth. It could be that. Mignon, I think so. It's the cortisol level. Yes. Tiffany is saying visceral fat. Yes. Where do you inject the Lipo C? I inject it in my thigh, friend. There's 142 people in the chat. If you are new here, click on my picture. Make sure you guys are following me. You guys, thank you so much for getting me up to 22.3K likes. Again, Andrew, chocolate coated says, your stomach is life. Hey, Sans, how are you? How are you? So yes. Let's see. Any other questions? Do they have something for skin tightening? Who, baby? Does who have that? Oh, you mean just generally. So listen, what I do is I do my collagen peptides, and I do collagen peptides by Orgain. Now listen, does that mean you are not going to have loose skin? Friend, I think we all have loose skin somewhere. But if you start out with your collagen peptides, if you be faithful with your collagen peptides, at least your skin will look as pretty as it can possibly look for your weight loss journey. Okay? Thank you for the follows. Thank you for sharing a live. Does your lipo include B and C both? Yes. It does. Hey, Miss Francis. Can you do B12 in your thighs? Also, yeah. You can, friend. Yes. For the 150 people who are in the chat, click on my picture. Make sure you guys are following me. If you guys came on because you are wanting to start your GLP-1 journey using GLP-1 medications, you guys know I always tell you to go through your insurance company, see if your insurance company has these meds on your formularies. Call your PBMs. If not, ask them if you can do a PA and what is the criteria for your prior authorization approval. I'm still on the starter pack, but Amble sent me a notification to do a refill. I choose to stay on the same dose, but they went up. No, we didn't go up in price, baby. We didn't go up in price. 2.5 and 5 milligram cost $2.99. All higher doses are $3.79. Okay. But if you already have if you have not used all 3 doses yet, Sans, wait until you get to your third month, because they're gonna charge you. You understand what I'm saying? So if you're not on your 3rd month, don't do your refill. Okay, baby. I think sometimes it will automatically generate you to go into the patient portal every, I don't know why I want to say every 21 to 25 days. But for you guys who are on your starter doses and y'all have 3 months, you don't have to do that because you got your medicine already. But if you go in there and you order it, they will charge you. So just wait, friend. Okay. All right. So let's get into the pregame card because I see somebody asking me about it. Mignon is asking, I'm interested in Lipo C. I'm down 30 pounds, 2.5 months with Amble. What are your thoughts? I think you should do it. Can you take only Lipo C, or do you need to take the semaglutide and tirzepatide? There are 2 totally different things, friend. So I would recommend you do them both if you're gonna do them. But if you had to pick one or the other, I would say do your GLP. Do your GLP. Okay, so I'm going to put the camera where I stand back here and talk about what's on my pregame basket. If you are new here, go ahead and click follow. We're going to talk about this pregame card. Hold on, let me pull it up. Now, y'all know I can't pull it up too much because TikTok will get me. So, everything that I talk about that is on my pregame card, you guys, it is in my TikTok shop. Everything that I talk about is in my TikTok shop, and then we'll get into what you need to ask for over the counter, and we'll talk about what you need to ask for that is scripted. Okay, so on my cart I have Kiala, y'all. I have I have 5 flavors, actually 6 flavors. I have green apple. I have tropical, carnival candy, watermelon, and then I have strawberry in the kitchen, and I also have Miami Vice in the kitchen. Okay. Then I also have Mary Ruth's vitamin and peach and mango. I have a collagen protein supplement that has hyaluronic acid. This is from Vital Authority. Y'all know they're very popular. I have some B12. I have Benefiber. That's a stool softener. You guys, I have collagen peptides by Orgain. Okay. The company Stir sent me several different flavors of their electrolyte replacement. Okay. I also have, I think my daughter took it out of here. I also have some, oh, here it is. I also have some liquid IV. That's electrolyte replacement. I have Seek. My Seek flavor is pineapple mango. Y'all, I'm working with a company right now called New Certs Health. I'm taking a vitamin B6 supplement that is supposed to yield me 2 inches from my waistline and 6 pounds down. So I'm trying that for 1 month, and then I have to get back with them at the end of this month to let them know how it went. Y'all, I have Blooms on my cart. I have multivitamin. This one is for my husband, his multivitamin. I have a hair, nails, and skin multivitamin. And then I also have bone broth. And then as far as my supplements, you guys, I put my supplements in these. Okay? Y'all see my gummies? I put my supplements in here. Babe, you bringing down my fall stuff? Okay. And these are some other supplements, y'all. This is how I do it. I'm sorry. Today is Wednesday, so I took my Wednesdays. I took all of my ones. This is Wednesdays, and I don't take these on Saturday. Y'all see? Uh-oh. Y'all see? That's all the supplements that I take, y'all. That's include my pre and probiotics, my multivitamin. I take a metabolism gummy, all by Ollie. All right. So let's talk about, oh, hold on. Let me make sure I don't have any questions. Let me make sure I don't have any questions, y'all. For the 147 people who are in the chat, click on my picture. Make sure you guys are following me. My name is KEASHA Dixon. I'm a registered nurse that comes on every single day to do GLP-1 education, you guys. And I share my 90-pound weight loss journey with you guys. So if you have any questions or comments, just put it in the chat. Hold on, y'all. I got to plug up the phone before it died. Just put it in the chat, friends. Okay. So if you're not following me, I'm officially your bougie virtual GLP-1 accountability partner. That's gonna be making sure you guys do all the things. Okay. So let's see. Let me make sure I don't have any questions before we get into OTC stuff that you may need to put on your cart. Hold on 1 second. Okay, I don't think so. Let's see. Amble didn't send me but 1 month. I was told that they were sending me 3 months. Lakeitha, how many months did you pay for? Because if they didn't send you 3 months and you only paid, and they only sent you 1 month and you only paid for 1 month, it's not a problem. You just have to go into your patient portal and request your second and third doses. I think the problem would be if they sent you 1 month and you paid for 3. But if they told you that they were going to send you 3 months, I understand what you're saying. But that is not a problem unless you paid. And then again, go into your patient portal, baby doll, and just let them know what your expectations was so that they can correct it. Okay, friend? All right. Okay, baby doll. Okay, so speaking to speaking to other things that should be on your cart, because there are some things that's not on there. Y'all, I got another little basket that sits in my bathroom that has some other OTC things. So I have chewable Tums, I have ginger chews, I have Upspring Settle Drops. All of that is for the belly. I have Nausine that helps with nausea. Over the counter, I have Prevacid. That's a PPI that helps with GERD, gastric reflux. And then I have Simethicone. Simethicone is it helps you with gas. Okay. In my cabinet, in my cupboard, I have some Pedialyte. I have Gatorlyte. I only do that on the days that I'm detoxing. If you are detoxing, that means you are actively causing yourself to have a bowel movement. You should be doing electrolyte replacement, because not only are you urinating and evacuating your colon, you're also pulling your electrolytes out with it. So you want to make sure that you are putting your electrolytes back in. Okay. What else? I have milk and magnesia. Y'all know that is my detox of choice. And then I also have some castor oil. I rub castor oil on my belly every night when I get out the bathtub. And I do that because it makes me regular. Okay? It does not give me diarrhea. It makes me regular. For the amount that I pour into my hand. And I mean, I put a good little bit. I put a nice little, I would say I put about 2 teaspoons in my hand. Rub my hands together and I rub all of my belly. Okay? And I have a bowel movement every single, and it's not TMI because I'm a nurse, y'all. That's how I talk. Listen, I'm not shy about nothing. When I tell you I'm not shy about nothing when it comes to my body, nothing. So yes, I have a bowel movement every day. Get into it. Okay. Who is asking if I am seeing their comments? Hold on, friend. Babe. Something's charging slow in here. Hold on, guys. Hold on, guys. Give me 1 second. Oh, shit. Okay. I think I got it. Hi, Pedialyte is good. Yes, it's good. It's good, friend. Does Amble have a discount code? No, friend. You just have to use the link in the bio. What is the Lipo C used for? Lipo C is a combination of supplements that when they're compounded together, they become fat burners. Boom, Nadine. Okay, Nurse Kendra, let me go back and see if I see anything from you. I added some filtered words, friend, because people have been doing too much and a lot of people have been having problems with their lives. Do you also get B12? With the Lipo C, Kendra, yes. Yes. Listen, let me show you. This is what it looked like, friend. If you're talking about the Lipo C, correct me if I'm wrong, Nurse Kendra. Sapphire, welcome. Welcome. Correct me if I'm wrong, Nurse Kendra. Are you talking about the Lipo C? This, right, Amble? Do you see how it says Lipo Mic? The Mic is the C, and then B plus B. Yes, baby doll. You do. You get B with it. Sorry about that, friend. Let's see. Somebody was saying something about castor oil. Thanks for the information. I need some castor oil. Yes, Terry, it works. Friend, when I tell you, like, I have the most gentle bowel movements. Honestly, they're very gentle. Like, I mean, like, I don't have to strain. I was educating yesterday. I was telling everybody that if you are sitting on the commode and you are bearing down on your bottom, it's not supposed to be forceful. You're not supposed to be having forceful bowel movements. Your bowel movements are supposed to be, gentle. Okay? And so if they're not, then if you add, like, rubbing your belly with castor oil on your belly, it will give your stool emollient coating. And then when you pass your stools, it'll be very, 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 very comfortable. Okay? Y'all, listen, I'm so excited. I'm putting up all of my fall stuff today. Let me just show y'all because I'm about to go. And I'm saying that because I'm getting excited. I want to put up my fall stuff and I want to show y'all what it looks like. Hold on, let me just show y'all what it looks like. Babe, I'm about to get ready. Hold on, let me show y'all. I'm about to turn my home into the fall, from spring to fall, and this is what it looks like. I'm so excited. This is what I'll be doing today. You want a personal trainer in GOP1 with add-ons? What you mean? Oh, hold on, y'all. That's me and my friend dancing. Thank you, baby doll. So I'll be videoing that, and I'm gonna be posting it. So I'm so excited. So can you tell us the podcast link? Hold on, friend. Let me pull it up for you. It's Health and Hustle. It's health. It's at health.hustle.pod. This is it. So if you guys are not following the podcast, go over to TikTok and make sure y'all hit follow. Go over to TikTok. Make sure you guys hit follow. Okay. We're gonna be. Thank you so much, Kay. Thank you, and Sarah. Thank you. I appreciate you. If you guys are new here, there's 114 people in the chat. Make sure y'all click on my picture. Make sure y'all are following me. And when y'all get out of the live, go and follow the Health and Hustle TikTok. We'll be posting clips from the first podcast episode here. And we'll also be dropping the very first episode announcement here. You'll be able to listen to us over on Spotify, Apple Podcasts, and you'll be able to watch us on YouTube. Y'all, I'm so excited. I'm so excited. I'm just so excited. I'm just excited for you guys to gain insight in the stuff that me, Andrew, and Kima be talking about on the phone. Because it's really going to give that vibe. Like, we really going to be getting in touch. Like, we really going to be having deep conversations and talking about the community, the medication, doctors, nurses. We're going to be talking about mental health stuff, body positivity, body insecurities, all of the things. And it's in the setting is going to be like as if you guys are just sitting, being nosy, listening to our conversation, because we ain't holding nothing back. Okay, so let me let y'all go. I'll be on later on tonight. You guys know I always end my lives. First of all, for those of you who are looking for the link for Amble, y'all know it's always in my website. It's always in my website. My website starts with HTTPS. It ends with KEASHA Dixon, so it's right here. You're going to click into that website, open it up, and you'll see a picture of me, and then you'll start to see the links. You're going to scroll down until you see tirzepatide. Hold on, guys. Sorry. Tirzepatide or semaglutide. YouTube. And you're going to click into tirzepatide or semaglutide. I'm going to click into tirzepatide just to show you guys what it looks like. This is what your patient portal will look like. And if you guys are interested, it takes 10 minutes for you to sign up. It takes us 7 to 10 business days for you to get your meds to you. Also, if you are a content creator or an aspiring content creator, the course that I used, that I've been using for the last 2 months, I now have it in my bio as well. I'm able to sell it now. Listen. If you're trying to grow your page and you're trying to gain followers, this is a great course. Now, when I first started this course, y'all, I was only interested in growing my TikTok shop. And my TikTok shop has grown tremendously. Now I'm trying to get into the digital marketing part and the drop shipping part. And because I purchased that extra course, now I'm able to sell it. But I am using the tool. So if that's something that you guys are interested in, it's in my bio. When I bought it on a payment plan, and I set it up in my thing for as a payment plan as well, because it can be pretty pricey. But when I tell you, my TikTok shop is off the charts. It's been the best that it has ever been ever since I've been incorporating the tools that I've been learning in that course. Okay, so you guys have a good day. You know, I always tell you guys, it doesn't matter what you guys have in front of you, what you see, what you think is difficult, what you think is hurting you, what you think is holding you back, what you think is hindering you. If it's low vibrational, you may have a sick parent, you may have a sick child, spouse, you may be sick, but my pastor always tells us, he says, don't be moved by what you see, but move what you see by what you say. That means whatever it is that you are looking at that is displeasing to you, you speak life into it and you change it with your words. Okay, I don't care what it is, whatever it is that you are looking at, whatever it is that you are facing, you're not going to let it take advantage of you. You're going to take control of it, and you're going to start to speak life over it and life into it. So don't be moved by what you see, but move what you see by what you say. I promise you, with God in your corner, you can do anything. You can do anything. And if you're ever put in a situation where you have to choose the high road or the low road, always choose your character, always choose your integrity. Don't you ever let anybody make you take your crown off your head and make you come off your throne to get into the streets with them, because you are not street people. We are not street people. They do that over there. We sit on our thrones and we sit with our crowns on over here. Okay, I love you guys with all my heart, and it ain't nothing that y'all can do about it. Okay, y'all cannot take the love I have away from y'all, from me. It's mine. Okay, y'all belong to me. I love you guys. I will see you guys later on tonight. Have a great day. Bye. For those of you who are sitting here with me on YouTube, I love you guys so much. I always end the live with y'all first, but I wanted to end the live with them first. Listen, y'all, when I tell you that you guys on YouTube and you guys on Facebook, this is where my journey started. I started sharing my journey on Facebook and on TikTok. I'm sorry, on Facebook and on YouTube. And when I tell y'all, I think I started with 200 followers because I had created my YouTube page years ago. And over those years, I had gained 200 followers. Well, when I started sharing my GLP-1 journey, my YouTube channel has grown to over 5,000 followers. And when I tell you, I respect you guys so much for holding it down and sharing my videos and just supporting me with the views and all of that. You guys are number one. I hold you guys very near and dear to my heart, because you guys have been there from the beginning. From my very first injection, I did that on YouTube. My very first educational video was on YouTube, and I respect you guys so much for still being here with me, still holding it down, still speaking life over my journey, speaking life into my platform, and just coming into my lives, engaging with me. Y'all, when I tell you, that means more to me than anything. Y'all just being here on my lives, when I'm live talking and speaking and you guys are talking back with me and engaging and sharing things that you really don't have to share. I respect y'all and I love y'all so much for that. So thank you guys so much. If there's anything that y'all feel like I can critique myself on, anything that y'all want to see, anything that I can add, I do plan to be more visible on YouTube. I do plan on getting back into long form education. That's going to be coming up this upcoming week. I'm going to start dropping a lot of educational videos that are going to be long forms, because I know a lot of people on YouTube, y'all like long form educational pieces with pictures and all of that stuff. I'm definitely going to do that. So if you're watching in from Facebook, I will share those videos to Facebook. I will put a link there so that you can just click in from Facebook and also watch those videos. But I love you guys so much. And the same go for you all, don't be moved by what you see, but move what you see by what you say. And if you are someone who is interested in starting your digital marketing journey, you want to grow a platform, you want to start selling products because you are wanting to include or start having passive income, Again, I did put a digital book there that I've been reading and learning from that is helping me to grow my platforms. I am making more money in the digital space. There are other avenues that I want to explore, like drop shipping. So I'm doing my educational stuff there through that course. So it is now available to you guys, and I did put it on a payment plan. I got it on a payment plan, y'all. It can deem to be very expensive, but it's an investment. If you don't invest in yourself, who else is going to? Okay? There's nobody that you can go to that is going to share this information with y'all. I promise you. I DM'd a lot of people. And I got some tips, but it wasn't what I was looking for. It wasn't like what I'm getting from the course. So if that's something that you're interested in, I will definitely post that link here as well. I love you guys. There's nothing that you can do about it. You guys have a blessed day. Bye now.